As we've been telling you this morning, there is a growing push to get rapid antigen tests into the hands of more and more Canadians. Doctors and health experts across the country say it's one underutilized tool and one way to control community transmission of COVID, particularly with this transmissible Omicron variant. Saskatchewan, Nova Scotia, and New Brunswick, they're already distributing kits for free. Nova Scotia, 400,000 into libraries just announced. Quebec and Alberta say they'll follow suit in the next few days. Ontario, for the first time, sending them home with every school kit for this holiday. Manitoba and BC have said they hope to ramp up their availability in the coming weeks. So we want to talk more about this with Dr. Samir Gupta, who's a regular contributor to our program, a respirologist and an associate professor in the Department of Medicine at the University of Toronto. Good morning, Dr. Gupta.
Morning, Heather.
You always get to be my show and tell expert. We were remembering a few months ago, well, I guess at the beginning of this, we did a how to wear masks properly. We're going to do something we've never done before on live television. What are we going to do, Dr. Gupta?
Let's do a rapid test.
Let's do a test. Okay, number one, what is a rapid antigen test?
Yeah, so this is a test that tries to detect virus in your body, basically, and it's very similar to what we do with the PCR test. The technology is different, but the concept is the same. It works differently, and it has a little bit different characteristics. It's not quite as accurate as a PCR test,
okay,
but it's accurate enough to give us some very valuable information, and particularly to pick up asymptomatic infections. That's what it's designed to do.
Okay, I have more questions, but let's make sure we have enough time to do this. So how do you use it? Take me through step by step. I have my kit.
Okay, so we've got the same stuff,
okay.
And this is the Abbott test, lateral flow test. So this is the first thing you'll do is actually you'll start by just setting up your test tube.
My vial,
here.
Okay.
So you've got your development solution, right?
Mm-hmm. Right here.
Okay. So you'll notice there's a little line at the bottom here.
Yes.
And that's meant to indicate how high you put your solution. So usually it's 7 or 8 drops.
Okay.
Just put those in up to the line.
Got it.
Okay. Now you've got that. Now the kit comes with a little box that holds it in place here. So just stick that in my box
So it's
here.
ready to go. So the fluid is ready to go.
Yeah. Okay, and now it's the slightly unpleasant part, which is the swabbing. Yeah, so you're going to get your swab. Mm-hmm. The idea is to stick it into the nasal cavity about 1 inch in adults, a little bit less in kids. You'll feel some resistance there.
But, I mean, the PCR, that's the one that goes like, it seems like it's
PCR
right into your brain. We don't have to do that
much.
With this, correct?
Yeah, it's not nearly as uncomfortable as a PCR test. It really is just about 1 inch. And you're going to stick it in, and then you're going to rotate it or twirl it between your fingers about 5 times against the inner wall of the nostril.
Mm-hmm.
Okay.
Each nostril? Both nostrils?
Each nostril, yeah.
Okay.
And the idea is not to touch any other part of your body, so don't touch the outside of your nose. Really try to get it in. And we could do that right now.
You're going to tilt back, or okay, you're going to tilt back. Yeah, I'm just going to move off to the side here as we do that, so nobody has to look directly. Exactly. Okay, so around 5 times, about 1 inch out. On. Okay, not touching anything, and into the other nostril. Okay.
Yeah.
All right, 5 times in each. All right, all done. Now what?
Now you're going to put that into that solution that we had before.
Okay, ready to roll.
Okay.
In it goes.
And what you want to do is you want to get the material from the swab into that fluid. So you're going to move it around a couple of times inside there. Just kind of, press it down, just twirl it around 4 or 5 times so you're getting that out. Okay, now once you've done that, you're going to just lift it up a little bit, okay, halfway up, okay, and squeeze that cotton, squeeze any fluid that's in there out of there with your fingers.
Okay.
And then snap it. Yeah, you snapped it right away.
Yeah, sorry about that. Yeah, there's a little break in that, so it snaps right off.
There's a little break. So you just squeeze it halfway. And now you've snapped it, so you can see that the swab falls back in. Now you can close it. It comes with a cap.
Comes with the caps, yes.
Excellent. And now you open your actual lateral flow test kit here. You've already opened it. Okay. And you'll see that there's a place for you to actually put some drops of this fluid. Okay. And when you open the bottom of this, you'll see that there's a dropper there.
Okay. Won't be able to see this on camera, but we're doing it on our desks, on our respective desks. Okay, well, maybe I can hold it up. All right, here we go. Yeah, the dropper. And how many do we put in there?
You put in 5 drops into that hole.
5. Done. Okay? And that's that.
And now you wait.
15 minutes.
Exactly. And you're just going to discard everything else
Okay.
right into the garbage.
That's right. Except keep the fluid for the next time.
I forgot to say that at the bit, always a good idea to wash your hands first and blow your nose first before you do it.
Good point.
Make sure you've got a nice clean surface for it as well. It takes typically 15 minutes, but you'll see that you'll start seeing results a little bit earlier than that. I'm already seeing the lateral flow has hit the first line.
So it has mine. Big red swoosh.
Exactly. That's the sort of flow. We call it lateral flow. It's flowing across that test strip. And you're going to wait the full 15 minutes to make sure that you're not seeing two lines there, which is a positive. But you'll probably see one line probably around 3-4 minutes.
Okay.
That's somewhat reassuring, but you want to wait the whole time.
So I already took one this morning just to be sure, and I knew that it was going to be negative. That is good. So we wait, and as we wait for a little bit, let me ask some questions. You can see how easy that is. And
yes, so easy.
It's very easy. You know, in the UK, they have this slogan now, flow before you go. You know, they want people to do this quite regularly. Where do you see this as being a tool at this particular point in the pandemic?
Yeah, I think it could be an invaluable tool. So in the UK, they were mailing these to the general population. Hundreds of thousands of these tests were positive. The idea here is that if you're asymptomatic, we know that people can have asymptomatic infection, or you could be in what we call pre-symptomatic phase where you have no symptoms, but you're still contagious. There is a window where you can pass this on before you develop symptoms. And so the idea with these tests is that you screen yourself. You screen yourself before, for example, our daughter does it before going to school. You screen yourself before going to work. You screen yourself before going to a family function. And most of the time it'll be negative, but there will be positive tests, people who are infected who just don't know it. And that's really the job, what this is for. And it's to prevent people who unknowingly could spread this virus to other people. And it could have a huge value where we are right now in our pandemic with Omicron.
So the concern, and you mentioned it, concerns about accuracy. I mean, what can and cannot these do? That's not a very whatever. What can they do, and what do they not do or cannot do?
Yeah, so a couple of things. One is that if it's positive, the recommendation is still to go out and get a PCR test to confirm that it is indeed positive. There's a small chance of a false positive. There's also a chance of a false negative, and it's sort of important, how we conceptualize that. A PCR is more accurate in that it is possible you'll get a negative on this test, but if you actually are in the early stages of disease and there's not a lot of virus in your system, the PCR would show it, but this wouldn't. So that would be a false negative. But practically speaking, you're also at a phase of your disease then where you're much less contagious. So for the purpose of identifying somebody who has enough virus to be contagious, actually the test is very good for that. It's very accurate for that. So there's a pretty small chance that you're going to be negative, but you're still contagious to other people. And that's the important thing. Now, one issue with that, though, is that if you're symptomatic, you do have a higher chance of actually having COVID. So we wouldn't want to risk a false negative. So people who are at higher risk because they're symptomatic, we prefer that they get a PCR test. Not that they can't do this test, but if it's negative, you can't put a lot of stock in that. You have to go make sure you're actually negative with a PCR if you have symptoms. So it's really suited for an asymptomatic person as a screening test. So
given those limitations, does that help explain why there's been such reluctance in this country to embrace rapid tests as a tool? Because now you're hearing health authorities and provinces and the federal government too say, let's get this into use as much as possible. But that hasn't been really the message to this point. And for some, it's been mystifying. Why not? Can you help us understand that part of it?
I wish I understood that, Heather. It's been a mystery to me too, because the federal government procured many, many tests and distributed them months ago to the provinces. Most provinces have used less than 10% of what was distributed. In Ontario, it's higher. I think it's 40%, but still the vast majority of these tests haven't been used. I think the challenge for provinces has probably been trying to figure out which populations to use them in. And unfortunately, that's meant that it's almost been paralyzing. They just haven't used them. And it would have been better to just use them up as soon as possible and keep acquiring more tests. I think finally we're going to see these going out. But, this is something that I think could have played a much bigger role up to this point in our pandemic.
All right, well, catching up now, obviously the emphasis is on coast to coast to coast. So with the holiday season here, or upcoming, but certainly people already thinking about their plans and maybe adjusting them because of Omicron, how should we use these? How frequently? How should we use these for holiday gatherings, Dr. Gupta?
Yeah, so we will all be taking this test before we get together for a small family get together. And that's just a great way to use it, in that it gives you that extra layer of security that you are very unlikely to have asymptomatic disease and be able to pass that on to anybody else at that get together. Obviously, we want people to keep get togethers small this year. Unfortunately, a month ago, it looked like we would finally have Christmas, and here we are. Scientists and doctors are the Grinch who stole Christmas, but it really is Omicron, and it's a different beast. And what we're seeing right now in other parts of the world, and even here, is pretty scary in terms of cases. So we want those get-togethers to be small. We want people to think about ventilation, distancing, masking. Ideally, everybody at that get-together should be at least double vaccinated. And this is that final extra piece of protection that hopefully people can get their hands on these tests, and everyone should do one before going to that get-together.
Okay. So valuable. Thank you, Dr. Gupta. I can hold mine up, I think. I haven't been the full 15, but I've got a single line. How about you?
Yeah, I'm good too.
We're good to go. All right. Very important, very valuable, as are your insights, as always. Thanks, Dr. Gupta.
Pleasure. Take care.